Hey everyone, my name is Paige with NCLEX Reviews. Let's continue digging into those alternative question styles. Today we're going to go over what's known as a drop-down cloze question, which is one of the newer next-gen NCLEX style questions that you might see when you take your NCLEX, which is right around the corner. In addition, we will be hitting on some maternity nursing care basics all at the same time. So let's tackle this question type and get some high yield content review at the same time. Two birds, one stone, let's go. With the next gen NCLEX, there are a variety of question styles that you may see. You may have watched some of our other videos already where we covered several of them. For this video, let's talk about what a drop-down cloze is. Don't let that name fluster you. Really, cloze just means fill in the blank. With these questions, you will be completing a sentence by filling in the blanks appropriately using a drop-down box containing the answer choices. So have you ever done one of those Mad Lib books before as a child where you fill in the blanks with different parts of speech to make the paragraph funny or interesting or silly? So these are just like those Mad Libs, except we are talking about nursing interventions and client care. There may be one or more drop downs to complete. So within each drop down, there will be between 3 and 5 answer choices. Nothing tricky there. Just fill in those blanks and make sure it makes sense as a whole. As far as scoring, you can get partial credit on these, which we love. So let's say, for example, that there are 3 drop-down boxes. You will get 1 point for every box you fill in correctly and 0 points for incorrect choices. So your maximum score will be the number of drop-down boxes that there are, and in this example, that is 3. So the lowest possible score would be 0. So even let's say you miss all of the drop-downs in a question, it's not going to deduct from your overall score. All right, let's go ahead and dive into a practice question here, and we can practice this style of question. All right, so a 32-week pregnant prima gravida client presents to OB triage with vaginal bleeding. Upon assessment, bright red vaginal bleeding is noted and the client's uterus is non-tender. The registered nurse suspects a possible diagnosis of blank and anticipates that the provider will order blank for the client. Let's go ahead and look at our answer choices here. So our answer choices in that first drop down: placenta previa, abruptio placentae, preeclampsia, group B streptococcus infection. I want you to go ahead and take a look at those answer choices for our first blank here and make sure that everything is making sense to you. Go ahead and pause if you need to before we go ahead to the next blank. Okay, so our next drop down includes the following interventions: pelvic rest, an emergency cesarean section, intravenous penicillin, or intravenous magnesium sulfate. Go ahead and take a look at these answer choices now and make sure that everything is still making sense to you. Go ahead and pause if you need to before we jump ahead and work through the answer together. So here is our answer. The registered nurse suspects a possible diagnosis of placenta previa and anticipates that the provider will order pelvic rest for the client. We'll go ahead and talk this through together now. So with placenta previa, some key assessment findings would be that non-tender uterus coupled with that bright red vaginal bleeding. On the other hand, with abruptio placentae, commonly known as placental abruption, we would be expecting a severely painful uterus that would require an emergency C-section. It is an emergency. IV penicillin and IV magnesium, these are sometimes ordered by providers to manage group B streptococcus infections and preeclampsia, respectively. Magnesium IV sulfate can actually help to prevent seizures in our clients who have preeclampsia. Group B streptococcus, that is a bacteria that's commonly found in the genital tract of many, many women. However, if it is transmitted to the baby during delivery, It can cause serious illness and even death for the baby. So, administering IV penicillin intrapartum or during labor, that is going to reduce the likelihood of spread to the baby. So, back to our client at hand that we were talking about, we would absolutely anticipate needing to educate them on pelvic rest. So, what is pelvic rest? Do you remember? So, from a nursing standpoint, that means not inserting anything into the client's vaginal canal. So, for a nurse, that would mean absolutely no cervical exams or vaginal swabs. So, for these clients, we would need to educate them to abstain from sexual activity or inserting douches or tampons or anything like that. So, now you see how these drop-down Cloze questions work. You've got this. You just take them one blank at a time. These are fairly straightforward. Just to jog your brain a little bit and make sure you're all still awake and with me, let's do a little bonus question here. So, what is a fairly simple way that we can assess fetal well-being? Were you thinking of a kick count? If so, you've got it. So, what is that kick count? When we want our pregnant client to perform a kick count, we ask them to count the number of fetal kicks or movements that they feel within a time period, usually an hour or two. So what would be a normal kick count? You remember? That would be feeling 10 movements within 2 hours. That would typically be reassuring. All right, everyone, we did it. We made it through another question type that you might see on your next gen NCLEX. So remember, these newer questions, they only make up about 30% of your exam. So with the majority of them, it is going to be those traditional multiple choice style questions that you are all familiar with and used to. Make sure you go ahead and tune in next week though for another next gen question style. Go ahead and hit subscribe so you don't miss any of it. You can absolutely do this. We are all rooting for you. Happy studying, everyone.